Hi everyone. I would like to start this presentation by acknowledging my co-authors. Here are our disclosures. Vertebral body tethering is a motion-preserving growth modulation technique. Although it's a flexible system, generated compressive and destructive forces at the end plates and discs have raised concerns for a potential cause of degeneration over time. We included thoracic VBT procedures, all of whom had all thoracoscopic surgery. Thoracic MRIs were obtained preoperatively and at a minimum of 2 years follow-up, where both intermediate and adjacent segment discs and facet joints were evaluated. Firman classification was used to grade intervertebral discs. Facet joint degeneration grading was adapted from Weishaupt's and Park's studies. 25 consecutive patients with a mean age of 12 were included. Sanders and research scores and their menarche status pointed towards significant growth potential. Several statistical methods were used to compare MRI findings, as well as radiographic measurements, clinical height changes, and patient-reported outcomes. This slide shows the distribution of Lenke types and locations of surgeries, as well as perioperative details. Please note that there were 5 Lenke 1AR curves, but only 3 long thoracolumbar procedures, as we believe that this may have influenced some of our results. Measurements have revealed an increase in total body height and UIV-LIV height, which was reflected into curve corrections in the operated main thoracic and non-operated thoracolumbar lumbar curves. Follow-up MRIs were obtained at a mean of 29 months postoperatively. At that time, most of the patients have reached or were close to skeletal maturity. A total of 217 levels of discs and bilateral facet joints were evaluated, and vast majority of them did not show any degenerative findings. One case, who already had a preoperative multi-level moderate disc degeneration, experienced an increase in disc scores. Another case, who was a Lenke 1AR curve operated by thoracic-only surgery, experienced a new onset single-level bilateral grade 2 facet degeneration. Complications and reoperations recorded before and after the visit that the follow-up MRIs were obtained are shown in this slide. Patients displaced increased SRS-22 self-image, mental health, and subtotal scores in their latest follow-up. In conclusion, intermediate and adjacent discs and facet joints, subject to compression and relative stabilization during a mean of 29 months of VBT growth modulation, did not demonstrate statistically significant radiographic degenerative findings. Studies in larger cohorts with a longer follow-up are warranted. Thank you for your attention.